Welcome to the Harris School of Policy's Summer of Social Impact Forum. My name is Karen Anderson, and I'm the Senior Director of Policy and Communications for the Becker Friedman Institute for Economics, or as we call it, BFI. We're delighted to collaborate with the Harris School on tonight's program. Like many fields, the economics community has responded with incredible effort and speed to the COVID-19 crisis. This work has had immediate impact on domestic and international policy decisions. It's my pleasure to moderate tonight's discussion, which will focus on the Chicago economics community's response to the COVID pandemic. Let me start by quickly introducing the three fabulous economists who will participate in tonight's discussion: Peter Ganong, Michael Greenstone, and Chang-Tai Hsieh. Peter is an assistant professor at Harris Public Policy. He studies income volatility and policies to mitigate its consequences. More recently, and what we're going to hear about tonight, he's done extensive work on the unemployment benefits during the COVID pandemic. As a side note, he previously also served in the White House Council of Economic Advisors. Michael Greenstone is the Milton Friedman Distinguished Service Professor in Economics, the college and the Harris School. He's also director of the Becker Friedman Institute and the Energy Policy Institute at UChicago. And he previously served as chief economist for the White House Council of Economic Advisors and as the director of the Hamilton Project at Brookings. Chang-Tai Hsieh is the Phyllis and Irwin Winkle-Reed Professor of Economics at the Booth School of Business. He is also co-director of BFI's Economic Development Initiative and a faculty director with BFI China. We have to get in all the BFI titles. So we're going to kick off things by asking Michael to give a really brief overview of BFI's work during the COVID pandemic to support and amplify the work of the full Chicago economics community. Then we're going to launch into our roundtable with all three scholars, followed by audience questions. If you'd like to submit a question, you can do so at any time by using the button on the bottom of your screen. We would ask that you please include your name and affiliation when sending in a question. And just another note, as our panelists discuss their research, we're going to include links for their papers in your side chat section so that you can have that for background. So with that, we'll turn the program over to Michael.
Thanks very much, Karen. It's a great pleasure to do this. So as some of you know, and maybe more of you will find out if people who are going to enroll in the fall, the BFI supports the university's roughly 250 economists, and we kind of set ourselves two goals. The first is one, to facilitate the development of new research and production of new ideas that help people understand the world better. And then the second is to make sure that those ideas don't get stuck inside academia, but enter the broader world forcefully and effectively. And Karen helps lead our efforts in that. She's really a star at it. So when the COVID crisis came, I think like a lot of people and institutions, we were wondering what could we possibly contribute. As economists, an enormous shortcoming is we couldn't actually treat anyone who was sick, or at least that would not be wise. And second, we were not going to be helpful at finding a vaccine. So what we, after much contemplation, decided we should do what we always do, and that is do some research. And this seemed like a prime situation where we were kind of in the fog of war. And I think we're probably still in that fog where things are moving very quickly and it's hard to follow exactly what's happening. And what we set out to do was to try and bring some facts to this. And actually, Peter and Chang-Tai have been absolute stalwarts at doing this. So we've done that in several different ways. For those of you, Karen has insisted that I mentioned that the website is bfi.uchicago.edu, so type it in. But we've done several things. First, we put out a call for proposals. We didn't actually know if anyone was going to respond. We thought that people would want to do research on this, and it was just a tidal wave of people who were interested. We gave out 21 research grants. Since then, we published 65 COVID-19 working papers. Been incredible swelling of productivity around that. A nice thing that we've come up with is to create facts. So meant to be very accessible facts that you should be able to explain to your friends or your parents about various aspects of COVID, which I think are a neat and digestible way to communicate some of the results. And the result has been, there was no field, of course, of COVID economics, is that I think kind of that field is being invented in real time at the University of Chicago. and that's also not just inside academia, but in the broader world. You Chicago economists have appeared in or authored more than 500 original news articles in prominent publications. We even started a podcast. We have two terrific hosts, Eduardo Porter from the New York Times and Tess Vigland, who is formerly the anchor of Marketplace. I'm not good at knowing if something has been downloaded a lot, but I will say this: we have like a frontline partner in Stitcher, and they seem very pleased with what's going on. So you should feel free to listen. There's been a lot of website traffic to the BFI site. So the main idea is that this is an example of what BFI tries to do. It's an example of what the Chicago economics community tries to do, which is to understand the world better and communicate it in powerful, effective ways. And I look forward to a discussion with my colleagues, Chang and Peter, about what some of their research has been about. And I'll talk a little bit about mine. And of course, we will be directed and controlled by Karen Anderson.
Great. Well, Michael, while you're in the hot seat, we'll start with you with an opening question, and then we have a question for Chang and Peter before we open it up for audience questions. So start sending in those questions. So Michael, back in March, when the pandemic hit America hard, you and a co-author put out a paper that received quite a lot of attention and is still receiving attention on the economic benefits of social distancing. You found that if all Americans engaged in moderate social distancing, just followed the CDC guidelines, that by September, which is right around the corner, we'd save over 1 million lives by avoiding infection and then over 600,000 lives by not overcrowding hospitals. And you told us that that equaled about $8 trillion in economic benefits. So that's huge. Can you talk through your findings? And then if possible, how much of these benefits you think we've actually realized given where we are now with a country that clearly has not been fully following those CDC guidelines?
Okay, so thanks for the question. And this is kind of probably a perfect example. I don't know what Chang and Peter's origin story on COVID research are, but might be similar to what mine was. I just felt like I wanted to do something, and I didn't know what I could do exactly. And then I noticed that the debate was being conducted about how to respond to COVID. This is back in March. The debate was being conducted on, oh my God, the stock market is down, unemployment is going to go up, GDP is going to go down, and all these things were kind of denoted in money or dollars. And then there was this other stuff of, well, if we really got some social distancing together and contact tracing and all the things other countries have done and that have done to varying degrees in the United States, we would get some benefits from that. And those benefits would be measured in reduced fatalities. And I just thought, partially based on my experience in Washington, man, this is a totally unfair fight. We have dollars against kind of nebulous public health benefits. And that was just kind of, it was like a rock in my shoe. And then my co-author Visham's shoe. And then, we went back and forth about what to do. And finally said, okay, forget it. We have something to contribute here. Which is there's a very standard way in economics to convert lives saved into dollars. And it's based on something called the value of a statistical life. It was actually, the idea of it was actually invented here at the University of Chicago by Sherwin Rosen and Richard Thaler, the Nobel Prize winner, Richard Thaler. And the idea is that you can observe from people's behavior, that is, how much they protect themselves from risks, how they trade off the money they have to spend to protect themselves from risks, say by like installing an air pollution filter if you live in a very polluted place, how they're willing to trade that off against the reduction in risk. And so we used that and we said, okay, well now we have that. Now how are we going to know what the benefits are in terms of reduced fatalities? And so we went and turned to what I think was the kind of frontier epidemiological model, which was published by Ferguson. I think it ended up being somewhat controversial, but at the end, most of its assumptions have been upheld in the data. And said, Ferguson had this example of, well, how many deaths will there be in the United States if there's absolutely no social distancing? Everybody does exactly the same thing. They get on airplanes, they go to school, they interact with people, there's no masks, there's no 6 feet apart, on scenario one. And then scenario two, what happens if there's moderate social distancing? And that is, it doesn't correspond exactly to what we're seeing anywhere in the world, but it's not, I would say, that far. It involves isolation from people who are positive, closure of schools, quarantining of people who were sick, et cetera. And so we compared those two. And what we found is, which was the number Karen had, is that if we engaged in this kind of what they term moderate social distancing, there would be 1.6, 1.7 fewer deaths in the United States by October 1st. And we then multiplied that by the value of statistical life, accounting for age differences, and we came up with this number, this very large number of $8 trillion. That would be the potential benefits of social distancing, which could be contrasted with the various costs to the economy. And as Karen noted, I think that took hold because it gave something concrete that could be compared against the costs. So that's kind of the background of that paper. You asked, what's an update on that paper, Karen? And so I went and did a little digging, and the news is actually kind of remarkable. So if you take the epidemiological model as given, there are many, many fewer deaths than were projected either under the no policy scenario or the moderate social distancing scenario. And so that would imply, as kind of messy and uncoordinated as the response has been in the United States, that actually we are benefiting from a good portion of that $8 trillion to date. Now, we're not all the way through the period that was projected, but it would suggest that whatever is being done, partially by people's own behavior and partially by government policy, is saving many, many people's lives. And I think that's probably, I think that message is not completely out there. And so I would appreciate you asking that question and caused me to think harder about it, Karen. So that's maybe that's what I'll say for now. Happy to answer any questions.
Okay. I'm sure you're going to get a lot of questions on that as well. Okay, so Chang-Tai, if we can turn to you and turning to South Korea. So while COVID infections are still on the rise in many parts of the US, South Korea is doing pretty well. Infection rates are pretty low and the economy has actually stayed pretty open. You have a great working paper on South Korea's policy of publicly disclosing the detailed location information of individuals who test positive for COVID. I think it's like an anonymized tracking system, it seems. Can you talk us through the South Korean model and then tell us why we haven't even thought about enacting something like this in the United States?
Yeah, sure. So let me just begin by saying that I started to track this back in maybe at the end of January. I was following what was happening in China. I was starting, and if you remember, if you think about the world in the end of February, we were focused on what was happening in China. We were focusing on what was happening in Korea. It's one of the very first big outbreaks, and we were focused then on what was happening to EU, what was focused to Iran. And I knew that just from reading South Korean newspapers that they were starting to put in place big contact tracing programs, and they were also putting in place a program in which they would disclose pretty detailed information about all the patients that tested positive. So in a nutshell, what they did was the following. The first thing that they did is that they put in place a pretty serious contact tracing program by which they had a legal system where if you tested positive, they could get data from the mobile phone companies and from the credit card companies to get information about where you've been in the last 14 days. So that I think was a critical part of what they did, in addition to just the bread and butter work of just calling up people. So they put together very detailed data on where the infected people were. And then the second thing that they did is that they disclosed that information. As soon as that data was ready, everybody that lived in the same neighborhood as that person got a text with basically anonymized information about that person, saying that this person lives in the district, this is this person's age, and here's where this person has been in the last 14 days. So it's really detailed information. It gives the name of the grocery store, of the restaurant. It tells, it says whether this person took a subway, at what time. If they know, they say whether this person had a mask on or whether they didn't have a mask on. I was hearing stories about how people were responding to this information, that what was happening is that, if I got the news that my favorite Starbucks was visited by somebody who tested positive, then what you saw was that people started to avoid that Starbucks. But here's the key. When you talk with people, they also say that they avoid certain places, but they continue to go to other places. And the reason they did so was that they were fairly confident that the other places that they continued to go to were places where the risk of being infected was low, just because of the rigor of the contact tracing program and also the level of detail of that information. So what we did then is that we made a bunch of calls to people that run South Korea's largest mobile phone company, and they agreed to give us data on commuting flows in the city of Seoul. So what we wanted to do, what we were able to do is to measure the extent to which people changed their commuting behavior, whether we're talking about going to Starbucks or whether you're going out for dinner or whether you are choosing to go to work. And then we can measure how that changes in response to the disclosure of information about COVID cases. And here's the bottom line, that what you saw in Korea was that it seems that the combination of contact tracing plus just the response of people in response to information has managed to keep the infection rate low at the same time that they never closed down their economy. There never was a lockdown. And there's been a decline in the economic output, but it's much less than what you see in the U.S. or any other countries. So to sum, I think the way that one wants to think about it is that a lockdown is a very blunt tool. It's a very blunt tool, and it's a tool that it's perhaps the only tool that you have when you don't have a vaccine and you have no information, right? But if you did have information, then the first thing that you gotta recognize is that there are differences. There's a great deal of heterogeneity in the benefits and the costs of a social isolation. So the way that we think about what happened in South Korea is that through the gathering of information and the disclosure of information, they were able to tap into that underlying heterogeneity. So you saw social distancing in places where the returns to social distancing were the largest, in the places that were more likely to be infected, but you did not see social distancing in places where you knew that the returns to social distancing were low. Second, there are also differences in costs across people. So that was also an important part of it. To the last part of your question, Karen, about why we haven't done this in the US, I think fundamentally we just don't have that infrastructure. We don't have that legal infrastructure. We don't have that contact tracing infrastructure. That's the first part. So for this to work, you've got to have robust information about people that test positive. Second part of it, which I suspect is going to be an issue in the US, is that I don't think we've thought hard about what are the benefits of disclosing information about people relative to the cost. I think that we are focused on the cost, on the cost of the loss of privacy, but there could be instances where disclosing information about people can lead to large public benefits.
You know, Chang, I've thought, can I interject here?
Of course.
I've thought a bunch about this, why the policy response has been so different. And I think, you know, one, there's probably no denying that there's much more focus on the individual in the United States than in some other countries relative to, let's say, the society broadly.
Yep.
And I don't know a ton about South Korea, but there's this, you know, cowboy emphasis in the United States on the individual. My view on when we would implement a kind of like, you know, carefully calibrated contact tracing, like you described in South Korea, which is there's nothing totally doable in the United States from a technological basis, is that the cost would have to get greater before we would give up on the cowboy culture. And so they're just, you know, you would need to have many more deaths before it would be a societally desirable thing to do. And it's a very crude way to say it, but we have
Mike, that's an amazing statement.
Of like individual rights, but I don't think at any cost. At some cost, it becomes too high.
I mean, that's sort of, you think it's that 140,000 deaths, 3 million cases, and what's happened to our economy, that's not enough for us to start to think seriously about the better ways of doing this?
I do. I mean, New York, which is held as a, I mean, it's not that it's technically infeasible.
No, it's easy. No. There's no reason why we couldn't do it. But we haven't even really begin to talk about it. I mean, we've talked a little bit about contact tracing, but nothing like the kind of contact tracing that they did in South Korea.
Our contact tracing is totally junior varsity. I just talked to a friend, actually my co-author Vishan on this paper, who just arrived in New York City from he was visiting his father in Louisiana, which has you know, on the restricted list for New York City. So he lands, they hand him a piece of paper, say, you have to behave for 14 days. And give us your phone number and we'll let you know if someone on your flight had COVID. But there's like no checking up on whether or not he is quarantining or anything like that. So like, we're not serious about it. I totally agree, but there's nothing, it's not like it's technically infeasible to do.
No, I completely agree with that. I completely agree. And I guess one of the things I find just really astonishing, I mean, this is just a generic statement about sort of the gap between what the private sector can do and what the public sector can do in the US relative to what I see in Asia. It's just enormous. And I'm not quite sure, I mean, why that is, but here's a place where you see it.
Absolutely true. And I mean, let me just add one other thing. We'll just throw this into the conversation. Like, I hadn't done this calculation until Karen prompted me to over email last night. But we're way below. we're way below fatalities, even in the Ferguson model, based on the epidemiological model, even under moderate social distancing. So like, as incoherent as the social distancing has been in the United States, one interpretation has been that it has been, if you take the model seriously, that it has been very successful. And obviously that's not pure policy, that's people's behavior as well.
Right. So basically what you're saying is that there has been a tremendous amount of social distancing in the US. Yeah, and that's what's driving your answer.
Contact tracing focus that you're talking about, which is really, really careful identification of who's sick or who's been exposed, and then isolation of those people.
Right, but it's that's the first part. But the other part I want to add is that I mean, what happened in South Korea was that, plus using that information to basically minimize the extent of social distancing, because social distancing is costly. Is costly. So it's idea of trying to, well, if you want to socially distance, you want to do it in instances where it has a maximum possible benefit.
Yeah.
Okay. Well, I know I know there are a lot of questions coming in, but want to get to Peter. So this is drilling down a little bit more to US policymaking, and Peter definitely has the issue of the day, and I think he might have brought graphs and charts along for the ride. So,
and that's why we love Peter at BFI.
The tie and the charts. So as we mentioned previously, Peter has done extensive work on unemployment insurance benefits. As everyone is probably aware, if you've picked up a paper in the last couple of weeks, CARES Act benefits are set to expire at the end of this week. CARES Act included a very important $600 a week unemployment insurance supplement for eligible workers that complemented what they received at the state level. This is set to expire, and Congress is still negotiating a compromise. If I have this correct, Peter, House Democrats propose extending the $600 a week benefit. Republicans in the Senate say, let's cut it to $200 a week, and then maybe eventually phase it to 70% of workers' prior income. So Peter and his co-authors have received a lot of attention for their work, but I wanted to put Peter in the hot seat and just say, in an ideal world where an economist was making decisions, if you could structure the next round of unemployment insurance benefits for Congress, what would you propose and why? How would you do it differently than maybe either the House or the Senate proposal?
Thanks. Can everyone hear me okay?
Yeah.
Great. Okay. So I didn't have as much warning about COVID coming as Chang-Tai did because I do not read the Chinese or South Korean newspapers. But I had a little bit of advance warning because my wife's actually a doctor who takes care of COVID patients. And so, when we heard about COVID coming from China, we said, well, maybe there's a lot of differences. We don't really know what's going to happen here. And then she started getting emails from colleagues in Italy. And she said, Italy's not that different from us. Like, this is coming here really, really soon. It's going to be really bad. And so, I don't know, it gives, at least our household sort of went into lockdown 2 weeks before everybody else, just based on the basis of, it wasn't secret, but just like, the really horrifying stories from Italy at the start. And, after twiddling my thumbs for a while, when my wife was at the hospital taking care of people, I said, well, maybe it's time to start doing some research. And I'd previously done some studies of unemployment. And so I'm just going to say things that might be totally basic, but I just want to make sure that everyone's on the same page. So the US has broad community spread. We didn't get the disease under control, and we didn't do the policy of European countries to cover most of the lost payroll. We did a little bit of it, but not much. And so it was obvious at that point that unemployment was going to be really high once we shut down all these institutions. And what Congress did, I think to their credit, is said, let's make unemployment less bad than usual. And the way that they chose that $600 number, which Karen mentioned, of how much they're going to add, so it's your usual UI benefits are maybe $400 a week, it depends on some of the details. Let's add an extra $600 to hit the average wage in the US. And so for the average worker, that means that for the worker at the mean, that means that they exactly replace their lost wages. But any Harris student can figure out that if you take a single $600 and you apply it to everyone, that's going to have different implications at different points in the income distribution. And one nice thing about like our paper being in the press is that you get other versions of the graphics that are actually better than the graphs that you make yourself. So I'm going to share just one graph from our, this is the Gus Wezerek version of our paper. Can everyone see okay? I don't know if anyone can see okay. Hang on a second. Can I get a thumbs up from someone? Okay, thumbs up, perfect. So there are 5 groups on this plot. There are people who are getting $250 to $500 in weekly earnings, $500 to $750, so on and so forth, up higher in the earnings distribution. The unemployment system is progressive in the US. So for low wage workers, it usually replaces about 50% of lost wages. For higher income workers, it'll replace 30 to 40% of lost wages. And that's what you can see on the y-axis here. So this is 50%. The CARES Act bumps everyone up by $600 a week, regardless of what your prior wage was. And so what the effect is of that is that you just saw that y-axis change. So now the replacement rates for people who are at the bottom of the income distribution are over 200%. And the replacement rates are higher at the top of the income distribution, but less so. You might be wondering, well, why did they do it this way? So basically they wanted to do it quickly in the prior in the Great Recession, actually, I continue to work for and used to work for Karen and Michael. But in the Great Recession, they bumped UI benefits up by $25 a week in the Recovery Act. And so they had the code set and ready to bump up everyone's benefits by a fixed amount. And it turns out, and this is news to me and many other people at the time, it's actually much harder to tailor benefits to an individual than it is to tailor benefits to the than to just pay everyone a certain amount per week. And so that's why they ended up with the system that they did. And Karen asked, what would I have done? So I don't know what I would have done, but I think that virtually all economists that I've talked to agree that it would be better to replace a fraction of lost earnings than it would be to replace to do a single dollar supplement. So for example, like in my ideal world, I don't know what the right number is, but the key thing is that the terms of the debate should be about replacement rates. So in my ideal world, you'd have, one side says, well, we want to have a 60% replacement rate. And another side says, well, it's a pandemic, it's really bad. We want to have a 90% replacement rate. And we haven't had that. We haven't had that basically for a technical problem, which is, or not technical, a historic problem, which is underinvestment in state UI systems. And because the state UI systems have so much legacy code and bureaucracy and staff that are not able to, they don't have the technology and the investment necessary to make rapid and flexible modifications. We've ended up with something that is substantially more clunky than what I think any economist would choose, regardless of what you think exactly the right number is for the replacement rate. The other thing that I just wanted to add.
Peter, can I interrupt for a second? Let me just to play devil's advocate. Why is that so? Like if we think the marginal utility of is declining in income, maybe we should, your graph was terrific. We're giving lots of money to people who don't have it.
Great question. So I think about the unemployment insurance system as a way to temporarily replace lost income. So I would say the goal of the unemployment insurance system historically has been for the last 90 years and should be to, when your income falls, to replace some of that income loss. If your goal is to expand the income of people at the bottom, we have a good system to do that. It is the tax code. There are progressive policies like the earned income tax credit, which there have been proposals to expand during the crisis, which I think would be a much better way to deliver money to people at the bottom than the current system in the long run. Because this system is designed to help you temporarily. It's not designed to permanently raise the income of anyone.
I understand, but I'm not sure that's an answer to my question. What if you wanted to hand out marginal utils in tough times? Wouldn't you want to hand out as many as you could?
Yes, but I wouldn't do it this way. So let me be concrete about some of the problems in this way of handling it out. So there's one like particular irony, which of the way this is done. So we're handing out marginal utils in this world to people who are really negatively impacted, who we should be delivering transfers to, but we're not delivering, at this point, there's no government policy that I'm aware of that benefits essential workers. So you have situations like the following. I actually don't know about the status of janitors at UChicago, but if there was a janitor at UChicago who was temporarily laid off, she would be getting 150% of her prior wage when she's laid off. But the janitor at the hospital downtown where my wife works and is facing, that janitor is facing significant excess health risk and has to keep going to work. That person hasn't gotten a raise at all. And so, there's a fairness issue here, which makes me want to do more transfers to low-income essential workers, and stepping back, more transfers to low-income workers in general who have been hit particularly hard by this recession, regardless of whether they're in work or out of work at this moment. If you're out of work, you have a problem. If you're in work and you're an essential worker, you're facing increased health risk. But the UI system is probably not the right tool for doing that. I would think that the tax code is, at least in the medium run, a stronger tool for accomplishing that goal.
Peter, can I ask you a question? What is the difference between workers getting payments through the UI system or through the Treasury versus getting payments through their companies, which are then reimbursed by the Treasury? Think of the second as what the Europeans have done. At the end of the day, neither worker is doing anything. So what difference does it make if you do it one way versus the other?
So I think there's pros and cons is the way that I think about it. I'm curious, feel free to jump in if you have other stuff, but let me talk about one specific pro and one specific con. So the pro of subsidizing companies is you just keep getting your old paycheck. We don't have you getting less than you were getting before. You don't have more than you're getting before. Your employer already knows how to pay you. So there've been actually really dramatic problems with the UI system, having a lot of trouble processing claims in a timely fashion. So you have people who are waiting 8 weeks, 10 weeks to get benefits. And in some of our research, we've actually found that if you're waiting 8 weeks to get benefits, you cut your spending by about 20% while you're waiting. And so that's bad, that's really bad. And so the UI system is clunky at getting the level right and getting the payments out in a timely fashion. I think the pro of the UI system is related to something that's been like best illustrated in the work of Steve Davis, who's our colleague at University of Chicago. So Steve Davis has done, just for everyone else on the line, a survey of employers. Do you plan to hire back the workers you've laid off? And basically the statistic that he comes up with is that 42% of layoffs are likely to be permanent. And that's because we're gonna need a lot more home health aides. We're gonna need a lot fewer live entertainers and restaurant workers. The jobs that we need for the next few years are gonna change. And so the UI system is much better suited, I think, to that sort of job switching. And if every firm just kept paying its old workers, we would never be able to hire more home health aides for the people who are not moving into nursing homes who need home health aides and the people doing grocery delivery. And so the cat is out of the barn, the cat is not out of the barn. The cow is out of the barn? I think the cow.
Some animals gone.
The cat's out of the bag, the cow's out of the barn. And in that world where we've already, chosen our favorite animal metaphor, I think that there's a real benefit to the UI system, and that the UI system is gonna hopefully make it more possible for workers to switch to the jobs that we need to get us through this period of a couple of years until we have everyone's been vaccinated. There's one last thing I wanted to just say before.
And I wonder if Chang has a view on this, and I'm sure you do too, Peter, on how much value is embedded in the firm-employee relationship and whether or not that's a greater risk through this UI-based system than keeping people paid through their employer. I don't, people raise that. I don't have a sense of the empirical magnitude.
I mean, I'm just going to say that the normal worker flows in just a normal year are already enormous. Like the workers that switch between firms. So it's something like 20% of the labor force every year. So in a normal year, there's already massive amounts of churning.
So that makes you, where you're saying that because that makes you think that the reallocation benefits that Peter was talking about are not that big?
No, I think that I think that the reallocation gains are huge, and that basically, if I interpret what he's saying, that the current U.S. policy is basically a big disincentive for reallocation.
Let me say, so that was the one last thing. Let me make my last point, which will then speak to this, and I can also answer Michael's question and tie it into additional UChicago research. But first, so there was a big concern that the $600 would be, well, in general, economists think, and I agree, that the UI system is better than keeping everyone on than payroll support in general. There was a concern that the UI system wouldn't be as good as we hoped it would be because the $600 raised replacement rate so much. So far, and this is, I think, been surprising to me, there is no evidence of job search disincentives from what is a massive increase in unemployment benefits. So that's surprising to me. That wasn't what I was expecting to see. The end evidence is very tentative. Like we still don't know, but you might have thought there'd be huge effects. And thus far, there's a bunch of essentially correlations that look like zeros. And I'm sure we'll have improved research in the coming years, but we haven't seen thus far much of the disincentive that you might expect. And it's a pandemic, all the rules are off. We don't know what's gonna happen. And so then the second point is that Michael asked, well, what do you worry about people switching jobs? Like, how valuable was the employee relationship? I think the value here is relatively not that high. So the jobs which have had the most layoffs are jobs that have really high turnover anyway. So that doesn't mean that it's still terrible to be laid off, but I think it's terrible to be laid off because of the individual, not because of the value
of the match.
Yeah. One piece of data that's relevant for this is there's a very famous paper by Bob Lalonde, who's a professor was formerly my colleague at the Harris School. Recently, unfortunately, he really tragically passed away. It's called Jacobson, Lalonde, and Sullivan. And it's about the question of when you get laid off from a job, how much does that hurt your future earnings? And the headline of that study is, "This is a disaster." But that study is specifically to people who've worked for more than 5 years at the firm. And in the paper, actually, he's very clear, even though people don't remember this part of the paper, that if you've only been at the firm for a short time, there's relatively not that much of an earnings. There's not a long-term consequence to being laid off if you haven't been at your firm for a very long time. And so the more that these layoffs are in the high turnover sectors of the economy, the less I worry about this match effects, although they could be. I think they're important in some parts of the economy, but I haven't seen a lot of evidence yet that they're important for this recession.
Although, Peter, you're only reporting part of the Jacobson, Lalonde, Sullivan canon. It shows up in all kinds of other social indicators as well, admittedly for the longer run relationships. But I think mortality rates differ. I think the children of those people who got laid off have, I don't quite remember the exact details, but maybe less educational attainment or things like that. So it is exactly the Jacobson, Lalonde, Sullivan that was prompting me to ask you that question.
All right, we had a lot of questions stacking up. Really quickly before we move off of UI, Peter, you also have a really cool paper that you did with JP Morgan Chase Institute data looking at the impacts of UI benefits on household spending. Can you give us a really quick nutshell on that, and then we'll turn to some questions? I thought the findings were surprising.
Sure. So I'm not going to screen share just in the interest of time. I'm just going to draw plots with my finger. So spending falls for everyone during the pandemic. That should be of no surprise to anyone. Spending falls more for the unemployed. That should also, before they get UI benefits, that should be of no surprise to anyone. UI benefits have been incredibly effective at increasing consumption. So UI spending rises when UI benefit payments begin for the household. The week that UI benefit payments begin, the week after, by about 30%. So the $600 supplement has raised the level of consumption of the unemployed who are lucky enough to get UI. I emphasized before, not everyone is. And they raised it not just to the level of the employed, not just to the level of pre-pandemic unemployment, but actually the consumption of the unemployed who are receiving UI benefits now is about 10% higher than it was pre-pandemic. So that says that this has been very effective as a macroeconomic stimulus. I think we're still unpacking what the micro consequences of it are.
Oh, great. We had a lot of great questions stacking up, and we're just going to take a few. But Michael, you will be excited to know that there were numerous questions, probably from very smart Harris students, about value of statistical life. Can you talk a little bit about the measurements, but how you think about, inequities, whether you have health insurance? I know you looked at age, but as you calculate your value of statistical life, how you take all of these factors into account?
Yeah, so the canonical estimates of the value of statistical life come from studies of whether or not people get paid more when they have riskier jobs. And there's a very long literature of some quality documenting that. And then with respect to what we did not assign people without health insurance lower values fiscal life. We just adjusted it by age. So that if you were 80, since you had fewer years left, we assigned a lower value than if you were 40. Actually, the U.S. government requires that all lives are valued equally. And so we also presented a calculation that did it that way. And the number is actually $20 trillion when you do that. And that's largely because so many of the fatalities associated with COVID come from people who are over 65, and even higher come from over 75.
Great. We have another question that I think any of you can answer, but probably mostly directed at Peter, based on something that you said. So wages, this person is noting that wages haven't gone up for many of the essential workers despite the increase in risk. And they're asking why these wages are so sticky, and then really what is the incentive for people to apply for these jobs?
So to me, it's not a deep puzzle, because as far as the $600 is very temporary. And so if I gave you the choice between having a steady job and having this $600 boost that's very large but doesn't stick around, or at very best it's uncertain because Congress can't get their act together to figure out what they want to do now. It's not, you have to think about the full dynamic value of the job, not just the instantaneous value at the immediate time. So I think it's not surprising at all that people are taking jobs that pay less than what they got on UI benefits. And to me, it remains an open question. What's the disincentive of the UI benefits? And to the extent that the existing estimates say there hasn't been much disincentive, I would interpret that as people are very scared about what has already happened actually in many states. And so they're paying attention to the long-term value of the job rather than the short-term value is how I think about it.
There's another question that I think, I know Michael will be excited about, but all of you all could jump on this one, which is asking about research conducted trying to measure risk compensation impacts of various COVID policies. For example, would mask mandates cause people to social distance less? Have any of you taken a look at this in your research, or do you have thoughts?
No, I think, isn't there this very interesting series of papers, which I only know thumbnail sketch of, documenting the benefits of masks, and that they're quite large for both the people around the person wearing the mask and also for the person wearing the mask. But I don't know, I haven't done anything directly on that. Maybe Peter or Chang know about it.
Well, if I can jump in really quickly and steal another question, I'd love to direct it to Chang, just because I think this is so interesting as we talk about policy impacts. And I know there are a lot of Harris students and alums who are working with development policy and in the international community. So Chang, you're part of a really prestigious group called the Bolton Committee, a group of economists and lawyers who have been looking at the issue of sovereign debt default. Can you just quickly talk to us about, why has this been such a big threat and problem, and what your group has been doing to try to get information out?
Yeah, sure. So what we started to see happening in March was that you started to see massive outflows of capital from places like Mexico and Brazil and Indonesia. And the way I make sense of this is that you want to think about the aggregate consequences of the kind of policies that Peter has been talking about. That is, the question is, when the U.S. borrows $2 trillion to fund the $600 payments, who's on the other side of that ledger? Somebody has got to be lending that money. Has got to be lending, and it's not just the U.S. that's doing it. A bunch of the European countries have been borrowing large amounts of money, and so the answer is that the money has to come from savers somewhere, right? Has to come from somewhere. So if it's not going to come from domestic savers or savers in the U.S., then the only place that the money can come from is from savers outside of the U.S. or from outside of of Europe. Now, what's also happening at the same time is that China is not the same as what it was 10 years ago. So the last time the US borrowed a lot of money, China was running a surplus of about 10% of its GDP. Even before the COVID crisis, China was already in a deficit. So it was not in a position to lend money. So what we started to see is that a lot of this, that a bunch of the funding for the U.S. stimulus programs was coming from basically investors in Mexico, Brazil, Indonesia, the Philippines that were basically liquidating their foreign holdings and they were buying U.S. Treasury bills. So another way to put this is that we started to see evidence that these massive spending programs in the U.S. was being funded on the backs of the countries that can afford it the least. Now, so then the question is, okay, capital is fleeing these countries to fund the U.S. stimulus program, to fund the program. What happens to these countries when COVID hits and they need to spend something? They need to spend, let's not talk about the 15, 20% of GDP the U.S. has spent. Let's talk about 5% of its GDP. And the answer is that there's no source of funding. So the only possible recourse that they have is for a large number of countries make large payments every year to service their external debt, and that really is the only possible source of income of money that they have. So what we were seeing was that sometime in the future, there's going to be a massive wave of sovereign defaults. So we were trying to get ahead of it and trying to say, this is coming. Let's figure out a way to try to manage this so that it's not as damaging as it could be. So that's what the committee was trying to do. And then we ran headlong into the lobbyists for the banks and for the bondholders. So I'm reminded of them. It's my first time. Mike, you probably don't remember this, but I spoke with you a couple of months into your job in the CEA, and one of the first things that you told me is that, oh my gosh, one of the things that I've learned from being in DC is that lobbyists are everywhere and they're real. They're real. It's not just some movie. And this is the first time that I've seen lobbyists in action. And it's quite a sight to see. So anyway, so that's a short summary of what we were trying to do to basically to try to mitigate the damage of COVID in poor countries, and a big part of it is coming about because of what the U.S. and Europe have been doing.
And Chang, I will say I think they prefer to be called policy advocates these days. Not
policy advocates. There. Policy advocates are everywhere and they're real. To paraphrase Mike.
All right, well, we are running out of time. We've been given the blessing to go a couple minutes late. One last question, Michael, just because this research is coming down the pike and it's so interesting. Testing, what do we need to be doing? People still really don't have great access to testing. No one gets really tested unless they have to or they're sick. What do we need to be doing on testing in this country? We're not going to have the South Korean model, but we could do something.
Waving the red flag in front of
I
me.
know.
Okay, so it's an absolute travesty that we do not know the answer to either what fraction of the population is currently has active COVID or what fraction of the population has developed antibodies. It is absolutely impossible to, in an informed way, develop nuanced social distancing policy without that basic information. And it's not that we're not doing that. We're not even trying to do it. Instead, we do convenience samples. My favorite is asking people, there's a study where they asked people at Whole Foods in Manhattan if they would take a test, and then are those people representative of the whole population? Absolutely not. And then, so there's really two problems with the approach to testing. One is, almost without exception, no study has set a random sample from the population so we could learn what the whole population is like. And there have been a few that have done that, but the second criteria, none have met, which is to make sure among the people you ask, you get a random sample. And so what we end up with is, I think even when you set the sampling frame correctly, you end up with people who volunteer to take the test. And people who volunteer to take the test, you can actually make up stories in both directions. It's very unclear to me. It might be people are really concerned about being sick, in which case we're overestimating the fraction of the population that has antibiotics been exposed. Or it could be the super health conscious, and then we're underestimating because it's only very, very healthy people are showing up. So as Karen knows, I'm conducting a study with a couple of my colleagues at Chicago that is trying to solve that problem. And we think that this is the way testing should be done for disease surveillance more broadly, not just for COVID, but it's an example of using ideas from economics to kind of invade other fields. So in this case, would be invading epidemiology, which does not think about how people decide to make these decisions to get tested. So in any event, the larger point is it's just a disaster that we don't even have a serious plan. But fortunately at BFI, we think we have the answer.
So stay tuned. And then the very, very last quick question for Peter. For all the members and staff who are still in their congressional offices tonight, hashing out the next wave of UI benefits, do you have any parting words of wisdom for them to ingest?
So there are a range of policy options that are floating around. There's questions about what's the dollar level of UI benefits. There's questions about should you do proportional, which we talked about benefits of that and the technical constraints. And then finally, there's an aspect of some of the proposals on the table we haven't talked about, which is triggers. So the idea of a trigger is that you change the level of UI benefits, you change the duration of UI benefits according to something like, say, the unemployment rate. And it's funny because I've had the same conversation with Democratic and Republican staffers who are, the Democratic staffers I talk to are absolutely convinced that we need $600 because we're in a catastrophic situation. And the Republican staffers I've talked to, at least in the past, thought we didn't need any supplement, or now the proposal's $200 because really everything's going to be okay and go back to normal soon. I think that this moment requires some humility. We don't know what's going to happen. Uncertainty is incredibly high. And what that means is that the value of triggers, meaning setting policy according to things that we don't know yet, is very, very high. I have no idea, and I think that you'll be hard pressed to find a UChicago economist who will confidently tell you that everything will be great in 6 months or everything will be terrible in 6 months. We just don't know yet. And so regardless of which side you're on in this discussion, I hope you'll seriously consider the possibility of using triggers. And I think of them as not a policy that spends a lot. I think of them as a policy that exhibits humility in the face of uncertainty.
Well, I would love to keep going, but we're getting flagged that we're way out of time. So thank you to Peter, Michael, and Chang-Tai, and thank you to the Harris School of Policy for hosting tonight's discussion.
Thank you.